Hi, I'm Chad.
I'm Becca.
I'm Brent.
And I'm Michelle.
Who here has a family history of arthritis? Okay, well, unfortunately for me, I have a few types of arthritis that run in my family. Science, technology, and medicine have advanced over the last years. And with it, so has the ability to identify, differentiate, and diagnose many forms of arthritis. My name is Kathrine Merry, and I'm here to inform you about 3 common types of arthritis. First, let's start off with the most common type of arthritis, known as osteoarthritis. This is also known as the degenerative joint disease because basically what happens is your cartilage and bone tissue start to degenerate, leaving you with sore and stiff, painful joints. As you can see here, the most common joints affected are the hips, knees, hands, feet, and your spine. Osteoarthritis has a slow onset and usually doesn't start until after the age of 40. According to osteoarthritis information found on the Center for Disease Control and Prevention website, over an estimated of 27 million people in America are diagnosed with this disease. Unfortunately, as of now, there is no cure. However, treatments are available to treat the symptoms of pain and swelling for this disease. In her 2003 book, Geriatric Medicine, Dr. Christine Castle says that treatment involves patient education, physical therapy, medication, weight reduction, and strength training so that less pressure is put on your joints. Now that we've covered the most common type of arthritis, let's move on to the most severe. The most severe form of arthritis is known as rheumatoid arthritis. This is less common, however, it is a systemic inflammatory disease which attacks all the joints throughout your body. It actually works in a symmetric fashion, meaning that if it's going to attack one side of your shoulder, it'll attack the other side as well, as you can see in this visual aid right here. It's going to attack both knees or both shoulders. This is an autoimmune condition which causes chronic inflammation, which eventually leads to erosion of the cartilage and bone tissue in your joints. The symptoms for this disease include pain, swelling, redness, fatigue, stiffness, and in the most severe cases, deformity. According to Professor Deborah Simmons, in her article published in 2010 called Rheumatoid Arthritis, Assessing Disease Actions and Outcome, 100 years ago, the only treatment for rheumatoid arthritis was aspirin. Nowadays, even though there still is no cure, treatments involve anti-inflammatory and steroid medications and also a routine exercise program to keep your joints limber and to help with the stiffness. Now that we know about the 2 most dominant forms of arthritis, let's move on to one that is a bit more unusual. Although less common and less severe, gout is also an inflammatory form of arthritis. According to the Arthritis Foundation, gout attacks joints when uric acid produces crystals that actually build up in the fluid that lubricate your joints. Uric acid is produced when the body starts to break down a waste product known as purine. Now, this disease was actually once known as the rich man's disease because it was once thought that the rich man's diet helped develop this disease, which actually has some form of truth because the common the most common foods high in purines are actually seafood, organ meats, and alcohol. Now, although gout can attack any joint throughout the body, the main joint that it affects is in your big toe, as you can see here. Gout causes severe pain and tenderness, and in severe cases, large bumps, as you can see. The gout attacks today are on the rise. And in his 2006 article, Pathophysiology, Professor Tang stated that gout attacks have increased by twofold just within the last 20 years. Although it's less severe and less common, and there is still no cure, some of the treatment that are used to treat gout are anti-inflammatory medications, and in severe cases such as these, they have to drain the fluid from the affected area. Now that we know a little bit more about arthritis, let's review. Throughout this speech, I have informed you about 3 common types of arthritis. First, the most common type, known as osteoarthritis. Second, the most severe type, known as rheumatoid arthritis. And third, an unusual type known as gout. If you have a family history of arthritis, hopefully now you will understand a little bit more about that disease. And if not, maybe next time when you see red knuckles, deformed hands, or maybe even a fat big toe, you'll understand how it came to be that way. Now, even though any type of joint pain and inflammation will lead to arthritis, please remember that arthritis comes in many different forms. If you have any other questions, I can answer them afterwards. Thank you.